Good afternoon everyone. This is the second part of the video on the topic of counseling and mental health. This video covers how to recognize the indicators of mental health illness. Please be with me and know something. Thank you very much. I already discussed about a global fact about mental health, types of mental health, okay, and consequences of mental health. Now, how to recognize it? I'm not stressing here to recognize the disorder. Of course, mental health specialist, psychiatric, doctor, psychologist, they will assess medically, they will assess the client health situation and identify what happened, which state of mind they have, which type of mental health they are suffering from. However, in general, in everyday life, because in every second, if we don't think anything, we are useless. So we think it, no matter what we think, we think. This is the meaning of life, okay? Now, if this thinking and thoughts are every second part of the life, why not we think about us? So before even like, saying, oh, this is nothing to me, this is not for me, or something like that, denial in one tongue. Before going to that state, the best way to think about our mental health situation is, do you feel like life is not worth living? If someone is thinking like, oh, my life is not worth of living, there could be some dangerous element there in their mind that could lead like, suicidal thoughts as well. So it is very important. This slide, basically, this is the mental health campaign, last year mental health campaign prepared by WHO again. So that's outsourced from WHO. They prepared this campaign flyer last year about mental health awareness. So do you feel like life is not worth living? There could be something to be concerned. And if you have experienced thoughts of suicide, self-harm, then what to do? Are you experiencing any of the following? You can see not only suicidal thoughts, not only worthless thoughts, what else other thoughts are there? Pain that seems overwhelming and unbearable. Oh, this thing happened to me, there is no treatment. If people think there is no treatment, there is no way to get me better. Feelings of worthlessness and hopelessness. I already asked the questions there. Loneliness, only feeling lonely, alone, enjoying alone. Constant negative thoughts. I already explained a lot about the mental health, how it built, It is not a magic like car accident and a broken leg or death. Mental health is something like escalate from one over again. It comes, it's like, you collect the things, thoughts, one over again, and it became bonds. And mind, the fresh mind will feel very hard to come out. Even the rose flower come out from the, like, all those spike in the branch. गुलाबको फूल पनि काँडाबाट फुक्क फुल्छ. It's a nature. Okay, so we also need to face lots of things in our life. It is always not easy and magic. We have to be ready to face the challenges. And when we cannot come out from those challenges, we cannot see the destinations, clear-cut ways. We are just inside a kind of bush भित्रै बसिरहेको जस्तो, कालो कालो बादल स्टोमको बीचमा बसेको जस्तो, आधी बेरीकै बीचमा भएको जस्तो, अनि त्यही चाहिँ कता कता गुडुल्मी 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 हराइरहेको जस्तो फगको बीचमा in the fog, in the middle of the fog, in the middle of the bush, you know, in the middle of the storm. यस्तो यस्तो खालको भइराख्ने र कता हो के हो हुने अस्तव्यस्त, like sometimes always feeling busy but unmanageable, you know. नेपालीमा एउटा उखान छ नि, मलाई एउटा साथीले पनि भन्नुहुन्थ्यो, सधैँ बिजी भन्ने पनि लाइफ हुन्छ, बिजी होइन होला, सधैँ व्यस्त भन्ने पनि लाइफ हुन्छ, व्यस्त होइन होला, त्यो अस्तव्यस्त हुन सक्छ, विचार गर्नुस् भन्नुहुन्थ्यो। साँच्चै के हामीले हाम्रो लाइफलाई म बिजी छु, म व्यस्त छु भन्दै अस्तव्यस्त त पारिरहेका छैनौं। र त्यति धेरै अस्तव्यस्त हुनु भनेको चाहिँ फेरि के हो भने त्यो चाहिँ सिम्पटम अफ सम सर्ट अफ मेन्टल इलनेस। त्यो यस्तो खालको चाहिँ अलवेज अनम्यानेजेबल, इफ लाइफ इज अनम्यानेजेबल, always busy and unmanageable could be a symptom of mental health illness. यो चाहिँ स्लाइड एकदमै इम्पोर्टेन्ट, भेरी जनरल स्लाइड, साह्रै सिम्पल तरिकाले चाहिँ प्रेजेन्ट गरेको भएर इट्स अ भेरी लिस्टिङ इन अ भेरी सिम्पल म्यानर, भेरी अन्डरस्ट्यान्डेबल म्यानर एन्ड युजफुल फर एभ्री सिंगल पर्सन्स इन देयर लाइफ. द्याट्स वाइ आई brought this slide for you. Okay. And difficult in understanding why you are thinking or feeling this way. First they think, and second they cannot sort out the exact reason of this thinking. They juggle between the reason of the thinking. Oh, that could be true, that could not be true, that could be true, that could not be true, you know, those kind of things. And feelings, that is also part of mental health, in symptoms of mental illness. And feeling that everyone would be better off without you. नेपालीमा एउटा छ नि, म नभए त तिम्रो जीवन सजिलोसँग बित्छ होला नि त भन्ने खालको यसरी चाहिँ रिसाउँदाखेरि घुर्की लाएर भन्ने चलन छ। म नभएर तिमीलाई के फरक पर्छ र, what will happen to you if I am not there, you know, those kind of expression, you know. So it means kind feeling neglect as well, and ignore, hate. If someone is feeling hate by someone else, ignored by someone else, and they start building their thoughts like, what would happen if I'm not there in your life? I'm not there. I'm not there for you. Or even we can talk about in every situations, like in the family, in the communities, in the workplace, you know, in every matters. What will happen if I'm not there? It will not affect you. Whatever I'm doing to you, it is not also impacting to you. You are not appreciating. You are always accusing and blaming, you know, those kind of things. So those thoughts and feelings grow literally, like, you know, step by step, and it will come as a symptoms of mental health illness as well. So it is very important to understand. Now, these are some questions. Are we feeling that? Are we feeling the difficulty of understanding why we are thinking and feeling? Are we feeling that everyone is better off without me? Are we feeling that you know, imagining what are the problems and there is no solution than suicide? Are we feeling that suicide is only one solution than my problems? Or are we feeling loneliness? Are we feeling worthless of life? Are we feeling hopeless? And are we feeling pain and it seems there is no treatment at all? Are we suffering from those kind of situations? These are the questions. We don't need to raise all those questions at a time in our mind. Even one question is there. Among these questions, if there is one question, it is a matter of concern. That could be mental health. It is not certain, could be, could lead to the mental health illness as well. So it is important to understand those questions, okay? And what you need to do, this is, you can see now, you can see the reference now, WHO, World Health Organizations prepared this flyer, and it was 2 parts. Part 1 I show you, and that's the second part. If those kind of questions are raised in our mind, regularly, building those kind of questions and situations, then what should we do? There are a couple of hints here, like you need to think you are not alone. Okay, many people have gone through what we are experiencing and they have found help. Don't feel alone is an important thing. Don't feel alone. Remember, you are not alone. At the last, you can see, remember, you are not the alone is an important thing. Okay. Similarly, it's okay to talk about suicide. If you have suicidal thoughts, it is not the end thoughts. Sometimes people think, miserable, they are suffering from miserable thoughts. They don't understand what really the person caring them. Okay. It's because of some like issues juggling in their mind. Could be many other reasons. But that is not the end one. It has to break it. There is a solution. If there is some concern in the mind, the best way I feel is sit and talk peacefully. Or write and, communicate. Communication is the key factor which help people to bring their state of mind at the equilibrium, in a balance. This is what I believe. If there is no communication at all, in any ways, and always thinking or not sharing what is happening, or thinking negativity about someone else, and not sharing, okay, this is what I think about you, not sharing like this, and escalating, keeping in the mind, and they become sick themselves. They blame other because of other people is happened. Okay, and they develop the fearness as well, fear, not F-A-I-R, F-E-A-R, fear. So according to WSO's slide, it is very important to understand that we are not alone. If the questions I said before were hitting our mind, we are not alone. There is a solution. Even suicidal thoughts, there is a solution. It's just a thought. We can think like, one day we will die. It's very easy to think. See, one day I explain this way. One day we will die, because I already told human being is born for death. One day, obviously, we will die. But people may think, why should we survive longer? I will die because my life is worthless. They magically think that way as well. However, we have to understand that that is only the thoughts. It's not the action. You don't need to push you toward the action. You have to stop. You have to seek a help to stop that thoughts. That's it. Very simple. So how to seek? You can share that thought to someone else, within a family members, within a friend circles, and seek a help. You don't need to straight away go to the psychiatric. You share that thought to your friend or family members or the closed one or anyone else. That person will help you to reach it to the medical attention and support services. So every single individual is important in everyone's life, and every single thoughts which bears the positivity is plays the significant role to make our life happy. Any negative thoughts also plays a deadly, deadly region, plays a deadly role to destroy our life. So it is very important to think it. Similarly, what can we do? Talk to someone you trust about how you feel. Talk to a health worker such as doctor, mental health professionals, counselor, social worker. See, so many professionals are given there. If you don't know who is a social worker, if you don't know who is a counselor, if you don't know where to go for the mental health, to find a mental health professionals, doctor, psychiatric, you talk to someone else, and that person will help you to reach at the level you are required. Okay, it's very simple. And if you think you are in immediate danger of harming yourself, contact emergency service on crisis line. That is an important thing. if you are really going back to the, pushing the, if you are going to push the suicidal thoughts ahead, not pushing back, pushing forward the suicidal thoughts, it is an emergency situation. You have to seek emergency help. In case of Australia, you dial 000, or you immediately visit your local doctor or talk to someone else. Don't hesitate to talk to someone else. Do not hide anything. Okay, so this is how we can save our life. And if our life is there, the all is there, then we are there for ourselves and for the community. It is always not the matter of becoming the billionaires is a successful person. A simple person, spending their life with a happiness and also helping other is also a successful person. So there is nothing to bother thinking, comparing ourselves to other people. Okay. So there are lots of options. Now I'm coming to the point about counseling and mental health. Okay, I'm stepping down, narrowing down towards the counseling, okay, and mental health, the interrelation between counseling and mental health. First, you understand what the stakeholders are, mental health stakeholders, like health professionals, mental health support worker, healthcare professional, healthcare and professionals. The counselor and therapist are also the part of healthcare and professionals. Family, relatives, friends, community, the organization, like global organization, international non-profit organization, INGOs, and government, non-governmental organization and governmental organization, like Health Direct. I told, for example, case of Australia, it's a governmental organization. WHO, World Health Organization, is non-governmental organization. It's a global organization, international organization. And let's say example, Behind the Blue is a non-profit organization, is a local organization in Australia, for example. So there are a number of organizations, similarly associations, in community associations, community organizations, which look after about the people's well-being and help, create the awareness, educate the people, support the community. They are stakeholders. And the people associated there, the leaders, the members are also stakeholders. Similarly, educational institute, schools, colleges, universities are also the stakeholders related to mental health. They are stakeholders of the other parts as well, but today I'm focusing only in the mental health and counseling. So I'm giving more emphasis on the mental health and the relevant stakeholders. So schools, colleges, there are mental health educations, the courses as well, in order to be fit, mentally fit, to make our state of mind balanced. We don't need to study mental health education. Okay, someone gives the ideas, someone teaches us, someone create the awareness about us, and we learn from our day-to-day life. Then we understand it. That's why every single person has a significant role to shape or to empower the other person, including family, community, and nation, and at a global level as well. We have a role for ourselves and for next person. Okay. Similarly, health center, hospitals, care centers, I don't need to repeat it. This is actually the part of the health stakeholders and the nations. Of course, the nation is the biggest, nation has the biggest role for their people. Okay, so they are the stakeholders. So from this slide, you can also understand counselors and therapists are also stakeholder of mental health illness, mental health sector. Okay, now how counselor help must be tricky, but I'm bringing some information to you. Okay, there are a couple of models to help the people who are suffering from mental health illness. And I'm not talking only about depression, disorder, anxiety, schizophrenia, I'm not talking only those things. As I already mentioned, there are more than 300 types of mental health illness. संसारमा हाम्रा समुदायमा 300 भन्दा बढी मानसिक रोगको चाहिँ प्रकारहरू छन्. 300 भन्दा बढी प्रकारहरू छन्, जुन कुरा चाहिँ यो रिसर्चमै पनि भएको हुन सक्छ. त्यसैले गर्दा हामीले चाहिँ आफूले नजानेको कुरा, थाहा नपाएको कुराहरू छ भने हामीले चाहिँ ए मलाई यो थाहा भएन, यस्तो रहेछ, ए हो र भनेर यसरी कसैले भनेको कुरालाई दिस इज ननसेन्स, यो काम नलाग्ने कुरा हो, यो वाहियात कुरा हो, इट इज ननसेन्स, इट इज नट नेसेसरी, इट इज युजलेस, यस्तो तरिकाले चाहिँ कमेन्ट गर्न हुँदैन. वी शुड नट कमेन्ट लाइक द्याट. We should, if we comment that way, that's a negativity. That is also the problem. We have to seek help to correct it. Okay, so these were the stakeholder where we could reach it very easily. Family member त हामीसँग नै हुन्छ जहिले पनि. Family member पनि stakeholder हो. मेरो family member को लागि म stakeholder, मेरो लागि मेरो family memberहरू stakeholder. Very easy to understand. तपाईको लागि तपाईको family member stakeholder, तपाईको family memberलाई कसैले के भइराछ भने तपाई stakeholder. You communicate each other. If there is no communication, it is a problem. They are unknown about the situation. They don't share the things from the bottom of the heart. And it builds the issues, the problems, tension, stress in mind, escalate, build the negativity. And one day, it may become a disease as well. So we need to understand ourselves, our situation, and we need to understand who the stakeholders are, who are close to us, to whom we can share. How can we reach in that place? Something like that. Okay. Now, professionally, I'm coming to the professionally. Professionally, there are a few useful models that health professional and health care use in case of mental health illness, in order to support and treat mental health illness. For example, social model, psychological model, medical model, integrative model, spiritual model, community treatment model, respect model, other than these models. Okay, the respect model I prepared myself, and the other are in general. We can see those models in the different resources. Okay, and we can see the practices as well in our societies and in the nations. Okay, so let me, I will not be going to discuss in detail about those model. As a social model, just social is like, social aspect of human being. It's not about society. When we say social, people who don't have pretty much knowledge about social science, social aspect, they quickly think about a society. Out of their home, they think community, and society. However, social model is a term related to a personal needs. Okay, as I already explained about the Maslow, Abraham Maslow, who designed a prism with a, from the basic, starting from basic needs to the self-actualization position, wisdom and self-actualization. In the prism shape is a needs of hierarchy. He developed that one. So those are the needs, are the social things. Basic needs are the social things. It's not the personal things. It's the social things. Seeking and getting education, financially sustainable, Those are social things. So social model is pretty much very important in mental health illness. Psychological model, of course, is a psychology, is a thoughts, feelings, behavior, attitude. Those kind of things come in the psychological model. Pretty much psychiatric and mental health practitioners will use the psychological model. Psychoanalysis psychoanalysis theory developed by Sigmund Freud in 18th century is still useful. He developed kind of talk therapy. However, he treated a mental health disorder kind of history as patient, and it was very useful, and still in these days it is useful. So there are a couple of changes, kind of cognitive behavior therapy is also useful in terms of treating the mental health illness, and those kind of psychoanalysis and cognitive behavior therapies, those kind of techniques will be used by psychiatric or mental health professionals. Okay. And medical model, of course, in case of mental health illness, people also will take a medical model, seeking the treatment, and having the medicine as well, medical model. Medicine as well. So taking medicine, taking tablet, taking medicine is also not a bad thing. Because when we have, I always used to say this thing, when we have abdominal pain, when we have a back pain, we get the Nurofen. We even don't go to the doctor. We just go to the pharmacy and buy the Nurofen, because I have a pretty much back pain. I don't know what happened. People buy, I buy, other people buy Nurofen without prescription. That's the medication. Okay. Medical, that's the medication. However, if there is something in our brain, if thinking, let's not say the brain, thinking issues, thoughts issues, we may need some sort of the chemicals for our brain as well. Because we need the chemical, medicine is a chemical, and our body is made by the biochemical things, including water. There are lots of chemicals, organism in our body internally. Okay. So if we have pain in eyes, there is eye drop, there is a different chemical. If we have chest pain, there is another medicine, different chemical. Okay. If we have something in our liver, there is a matter of insulin and something different medicine. So there may be some different medicine required for our brain as well. So we don't need to feel bad. People feel bad when they are taking tablet, some medicines, in order to treat their mental health. So if this is a situation, saying this means if this is a situation, if doctor are prescribing some sort of medicine, they take a medicine like, okay, well, something wrong, I'm taking. So they should not feel pressure themselves. Well, I'm sick because I'm taking a medicine, I'm mentally sick. They should not pressure themselves, because I have seen lots of people, some people in our communities who are taking medicine and they feel pressure themselves because I'm sick, I'm taking medicine. They don't need to feel pressure, because it will be okay. It will be all right. Like in how you take a medicine, Nurofen or Brufen, if you have body pain, and you take some sort of tablet because you have a problem in your thinking, it's almost similar thing. You don't need to worry about I'm taking medicine because I'm sick mentally. Don't think that way. It is not necessary to think that way. मानसिक तनावमा चाहिँ मानिसहरूले ट्याब्लेट लिँदाखेरि, औषधि लिइराख्दाखेरि, त्यो औषधि लिएको भन्दा पनि बढी चाहिँ म चाहिँ एकदमै मानसिक तनावले ग्रस्त छु, म एकदम मानसिक रोगी भएको छु, मैले यो औषधि खाएको छु भनेर त्यो सोचाइले नै उनीहरू पीडित भएको चाहिँ मैले पनि अनुभव गरेको छु, देखेको छु मैले। मलाई कसैले केही भन्छन् कि सोशल प्रेस्टिजको इस्युज पनि आउँछ, यसले त मेडिसिन खाएको छ भनेर मलाई हेट गर्छन् कि, मलाई चाहिँ मैले गरेको पर्फर्मेन्स, मैले बोलेको कुरा राम्रो हुन्न कि, यस्ता खालका सोचाइहरू लिएर हेजिटेट फिल गरेर त्यो व्यक्तिले आफैले त्यो औषधिले भन्दा पनि त्यो औषधिमाथि त्यस्तो खालको चाहिँ एउटा चाहिँ इन्फेरिटी, त्यो इन्सेक्युरिटी, फियरनेस, त्यस्तो खालको फिलिङले चाहिँ माइन्डलाई चाहिँ औषधि खाइरहेको छ, फेरि पनि त्यो प्रेसर दिएको पनि हुनाले इट इज नट नेसेसरी टु गिभ अ प्रेसर yourself in your mind. It's simple. Take it simple, like you having medicine when you have stomach pain, you have ibuprofen when you have back pain, you have some sort of medicine when you have a problem in thinking. There is nothing different. I don't think anything different. So even in our society, I request to correct the thinking. Here we have to correct the thinking. We have to correct our behavior towards others, because others, the behavior, our behavior towards others, your behavior towards others, will impact. It's a matter of concern. So we have to take it simply. So medical model is that model. Integrative model is a holistic model. It's a holistic approach. सबै कुरालाई लाइफमा एउटा इन्डिभिजुअल व्यक्तिको जति पनि एस्पेक्ट हुन्छ त्यो सबै एस्पेक्टलाई चाहिँ कभर गर्ने मोडल हो. इट इज अ होलिस्टिक मोडल. इट कभर्स एभ्री एस्पेक्ट अफ लाइफ. Similarly, community treatment model. Community treatment, I don't have much idea about community treatment model. I have seen number of the resources about community treatment model. However, I'm not speaking anything about, I'm not commenting about community treatment model. It is, for me, it is a part of research. It's still a part of research. And respect model, the model I created myself, and there could be other wonderful and useful model than these models as well. Okay. Now let me go to the respect model. What it says is basically respect, RESPECT, responsible, empathy, supports, priority, perspective, essentialities, continuous caring, trimming the tree. In relation to supporting and treating the mental health illness or mental health illness patient, or the people who are feeling low or having issues in the well-being, respect model is useful in my view. And this one is I design myself. Like being responsible, I already talk about stakeholders because it's coming through in a sequence way. I talk about stakeholders, I talk about the importance of family member, importance of communities and the professionals. Okay. And I talk about a lot about the individual thinking and thoughts as well. So these are the part of responsibility. How we care the earth. Not only environmentalists go and do the plantations and do the things and cleanness and care the environment. Every single person has a responsibility to care the environment. That's a universal truth, and it's a very simple logic. In the same way, caring is very important thing in terms of human beings care as well. When we walk on the street in the footpath, we do not push other person. We give a side. It's a caring. It is not only caring doesn't mean that we care only in child care or age care. Caring comes in every second, comes every second in everyone's life, in everywhere. There could be different type of caring, but it is important to care. Some people may not digest when other people are caring, cannot take in a positive way. That will create the problem as well. So here is the point. My point is, if there is any issues, there should be a communication. We have to build the communication skills and techniques. This is what the meaning of connecting the gap, bridging the gap between negativity and the reality. The reality in one place, the not thinking that is a real and taking as a negativity the other place. So communication bridge the gap between that reality and negativity. It is very important. Okay, and it's a responsibility. It's also part of responsibility. Every single individual has a responsibility on that. Okay. Similarly, empathy, feeling themselves, not only I'm right, understanding themselves, understanding other people, understanding the patient, being compassion with other people. It's empathy, and it is very important to become a compassiveness. Supports, of course, there could be different kind of supports, and people should have well heart mind to provide the support, to offer the supports. Priority perspective, what is the priority of a client? Of course, when we have a client with us, we need to identify the issues and problems and needs and focus on the priority first, giving the prioritize the issues in order. Similarly, essentialities, essential things are also important. Essentialities, priorities in one thing, prioritize, and essentialities, they are connected. Essential and prioritize. If the things are essential, they should be prioritized at first. So it is very important. Continuous caring in mental health illness, continuous caring is very significant. It plays significant role. And trimming the trees means it looks like a bit what is said, but trimming the tree is very simple to understand. You know why we trim the tree? Why we do the pruning and training the tree? Because we want to cut the dead cell, the broken branch, and we make it fresh and clean. We do the weeding in the plantation, in the garden. We do the weeding. We uproot all those weeds, throw the weeds, and make the garden clean and fresh, because it helps to grow. Pruning and trading also help the trees to grow the new leaves, new branches. The same way, the trimming the trees means the same way. If we have negative thoughts and the uncomfortable thoughts, they have to be identified and they have to trim it. It is not easy to trim. However, first it should be identified, it should be realized, and it should be get it off it. This is what I put the term trimming the tree there. And this is the model I placed myself. It is not tested anywhere. However, I feel it is useful and worthwhile to use in terms of helping and treating mental health illness. Now I'm coming to the end slowly and gradually. I know I talk a lot. Okay, this one is data, like I told before about community treatment model, which I don't want to comment anything. And this is also the part of the research for me myself. I need to understand the community treatment model, how it works, whether it is only electronic monitoring, or it is like people monitoring in the community, or like community organizations is helping, or taking responsibility or someone else. But I don't know. I'm not sure about this matter, community treatment model, to be very honest. Okay. And so I don't want to talk. But the purpose of this slide is in 2013, like in the report of 2013, all around Australia, comprising public and private health, private hospital. Okay, in Australia, comprising combining private and public health, they treated the mental health illness people. And what was the result is important. So I brought it here because it's interesting for me as well. So in terms of treating the mental health illness, it is not related to the counseling. However, if we say the community treatment, there could be I don't know the roles of counseling in the treatment, because counseling is not the treatment. It's not the medical and psychiatric treatment. People need to understand it. However, there will be a significant role of counselor in mental health illness people to make them better life. Okay. Now here, in short-term treatment, let's say example, 100% people, I don't know the number of patients here, but it's in the 100%, 50% recover in short-term treatment plan. 42% there was no changes, and 8% it was deteriorated. It was worse than the admitted. It is a short-term treatment. In long term, we always say there should be continuous treatment, continuous support. But in long term, I'm surprising myself. That's why I brought this slide for your attention. Like, I don't know the reason. Okay. So I feel there should be some area, some room to research further. Okay. In long-term mental health, only 26% people recover, and 58% people, there are no change in 58% people. It's a huge, more than 50% patient showed no changes in their life in treatment, and 15% gone down path, like worse. It's worse, deteriorated than the previous one. So from this data, I have a question like, is long-term treatment ineffective, not effective than short-term, or is short-term treatment is effective than long-term? This is a question raised in my mind. That's why I just put it here. And in order to support this slide, there is another slide. Just one moment. It's the same data. However, it has been divided into 4 categories. The number 1 category is public sector, people in ongoing community care. The second one is public sector, people discharged from the community care. Okay. And public sector, people discharged from hospital. Private sector, people discharged from hospital. I'm talking about the people, is only the mental health patient. Okay. Mental health patient in the treatment path in Australia. Okay. This is a data prepared in 2010 and 11. And various kinds of treatment, receiving various kinds of treatment, it has said, and I adapted those 2 slides directly from Australian government Department of Health website. Okay, and it is important to highlight those things for the community as well, because in the mental health treatment plan, there is a community treatment. We don't know what is community treatment. Even I don't know what is community treatment. Is it targeting only for a organization which help the mental health and wellness, which work in the mental health and wellness area, or they allocate some sort of health professionals from the department and monitor the mental health patient in the community. I have no idea. As I already told in the beginning, I'm not commenting here. It is also part of interesting and part of questions raised in my mind and part of research as well, further research. And from these 2 slides, I can see that long-term treatment in community-based treatment is not working, is a low result than discharge from hospital. You can see the series 1 in the blue color, significant changes. The mental health patient discharged from public hospital and mental health patient discharged from private hospital are higher than mental health patient who are ongoing care in the community and who are discharged from the community care. So it is so strange, like long-term care not effective than short-term care, and community care is not effective than hospitalized care. So there is a part of research for those who are interested. It is also this slide will make them curious to do the further research in these areas. And to separate, to distinguish, to educate the people what the community treatment mean, how it works in USA, how it works in developing countries and well-developed countries, how it works in Australia. It is very important to educate the people. Otherwise, if they don't know, or there is something wrong, or the mental health illness people scare about those things, that will be also a part of harmfulness as well. Okay, anyway, so that's the part of the research, further research, and stakeholders and researchers will do further research and bring lots of information about the community treatment models in coming days. Although there are lots of resources I already identify, and I even collected those, subscribed the academia, and for the further research and further studies. However, I didn't get much time and I haven't done it. And I believe those 2 slides will help the other stakeholders, researchers, bureaucrats, the leaders, the scientists, the psychiatric, and doctors, to dig more and to get the the good result, how they can get the good result in coming days.